Hello and good evening. My name is Dirk, and I'm the moderator for tonight's call with Congressman T.J. Cox. Thank you for joining our interactive event. We're hosting this event to give Congressman Cox the chance to speak directly with you wherever you are and to reach as many of you and answer as many questions as possible. This evening, we will be discussing COVID-19, also known as the coronavirus. As I mentioned, this is an interactive forum, and we would love to hear from you. We will be taking as many questions as we possibly can on this event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. They will take down your name and a brief summary of your question. The next time you hear your name, you will be live on the call, and you'll be able to ask your question directly. Now, this call is also being streamed online. You can find the online stream by going to cox.house.gov. Now, we're going to do our best to answer as many questions as we possibly can this evening. Now, we'll receive a lot of questions on this live event, so if we're not able to answer your question, please leave a voicemail after the event or send an email through the Congressman's website at cox.house.gov or by calling the Selma office at 559-460-6070. Again, if you have any questions during this event, please press *3 on your telephone keypad or type your question below the streaming player. Now, it's my privilege to welcome to the call Congressman T.J. Cox. Congressman, the floor is yours, sir.
Well, hello and good evening. Thank you all for being on the line today, and welcome to the telephone town hall. This is Congressman T.J. Cox, and I am your representative in Washington, speaking to you tonight from our Selma District office. The Central Valley sent me to D.C. with a clear message, to put the Valley first. And I'm proud of the work we've done, and I remain laser focused on those priorities to make a positive difference in your lives. But tonight, I'm here to talk to you about a challenge we're facing that's unlike any that we faced in a century. Tonight, we're here to set the record straight about the coronavirus pandemic, how long we can expect it to go on, how you can protect yourself and your family, and how we can slow the virus and eventually end this emergency. If you want to ask a question, and once again, let's please make sure it's about the current outbreak, please press *3 on your keypad at any point during this call to get connected. And once again, we're going to get to as many questions as we can. Now, I have heard from some people who think that we're actually doing too much, that we're overreacting. And I want to say that is simply not true. We absolutely need to slow the spread of the virus, which we can do if everyone gets on the same page. And we can get through this while not pushing our emergency health services, which are already stretched thin, past their breaking point. And we're absolutely in a critical week where what we do now and the steps we take for our families will save lives and stop millions more from getting sick. Since this week is so critical, I wanted to introduce someone here in the room with me. I've asked Dr. Rais Vohra, the Health Officer for Fresno County Department of Public Health, to join us today. And Dr. Vohra is also an associate professor in the School of Pharmacy at UCSF Fresno. My team and I, we've been working actively with Dr. Vohra, the state and the county, since the beginning of this outbreak. So I'm very glad we have him here with us tonight as an expert to both advise us on how to stay safe and let us know what the county governments are doing to monitor and handle this situation. Dr. Vohra?
Thank you very much for having me. I'm glad we're able to hold this important town hall. I know that there's a lot of information as well as misinformation out there right now about COVID-19. So I'm glad that we have this chance to get everyone on the call up to date about what's the useful information.
Great. And I know, Dr. Vohra, you've got a lot of responsibility, and you probably haven't had a break since this issue first surfaced. So I want to thank you again for taking some time out from what I know has been an exhausting few weeks. And just to start, if you could just give us an overview of where we are, where we're headed, how eventually you feel that this will play out, and most importantly, what we can do to keep our families safe.
Sure. I'll try to summarize what I view as the situation. So I'm sure everyone started hearing about this new virus called the novel coronavirus, also known as COVID-19. which was first discovered as causing human illness in December, very late last year. In fact, the word COVID-19 stands for coronavirus disease, discovered in the year 2019. So that's kind of where that term comes from. It started in a province of China, which very, very rapidly escalated into an outbreak there. As you'll recall, China made a lot of moves to quarantine off its population and restrict its global spread. But unfortunately, it did spread globally, and now what we have is a pandemic, which means that there's sustained community transmission reported from many different countries, almost every continent, and it's actually becoming now more and more widespread here in the U.S. So in the last couple of weeks, the reality has come into more clear focus that this is indeed happening all over the U.S. and here in California. Our numbers are going into the hundreds across our state. More locally in Fresno, we've been tracking this ever since we first found out about it as an emerging disease. And we've been in the planning and preparation stage for the last 6 to 8 weeks. A few weeks ago, we realized that with California having reported cases that we should expect those here as well, and that they would be related to travel. So we weren't surprised when the labs that we work with confirmed that one of the travelers that lives in Fresno County had tested positive for COVID-19. Now, this person was actually a traveler from one of the cruise ships. So that was another big piece of this, is that the cruise ships actually allowed a lot of people to catch this germ, and this gentleman was one of those folks. And so when he returned to Fresno County, he was asked to self-monitor at home, and then when he felt just a little bit ill, we got him tested, and he tested positive for this virus. Since then, we've had one other positive case, also in a traveler, and we're also doing a very similar program of getting that person into quarantine and also finding all of their contacts and making sure that they get into a program where they're going to be out of the public, staying in their home, and if they get sick, then we'll get them tested as well. So we're following the recommendations that are being put out by the Centers for Disease Control and Prevention about who to monitor, who to screen, who to test, how to treat whenever we find these cases, and how to go about doing the individual response. But at the same time, we're also very mindful that this is a huge societal and possibly cultural moment where almost everyone is going to have a role to play in helping to minimize the number of illnesses and deaths. You might have heard a term called flattening the curve. I hope we get to talk about what that means, but we're basically watching the peaks of this happening around the world, and the peak can look like a camel's hump, or it can look like the back of a dog, and we hope that it looks like the back of a dog, meaning that it's not a huge rise in the number of people who end up catching this germ and who end up transmitting it. But it's going to be up to all of us to help flatten that curve. And so I think what a lot of the listeners have probably been tuning into is there is so much coming out now about things like social distancing and self-isolation and home quarantine. And I know people have a lot of questions about what those exactly mean, why do we need to do them, what is the benefit, and I'm happy to have the chance here to tell your listeners about the rationale behind all of those. But it's basically, if you think about, that's really what we're trying to do, is flatten the curve and really just try to, like you said, spare our healthcare system and the rest of our society from the extreme stress that this virus promises to cause.
Yeah, well, Dr. Vohra, I've got the question, is that when we talk about flattening in the curve, is it the presumption that in a certain community that basically everyone will eventually get touched, but it's a matter of whether or not they're touched over a longer period of time rather than a shorter period of time, and in that shorter period of time, that causes that steep hump, and that's the case that overwhelms our health system? Yeah,
that's part of it. I mean, we obviously want the overall number of cases to be as minimal as possible. So we want the total number to go down. But regardless of what that total number is, we want to spread that out as much as possible. We know that most people actually do well with this illness and that they survive. But there's going to be a minority of our patients, probably maybe 10%, maybe 5%, who are going to have a really hard time. I mean, they're going to be in the ICU for weeks and weeks. About 3% fatality rate is what's being reported from multiple countries worldwide at this point. So we're expecting that we'll probably have a similar course here as well. And we just want that 3% to be, over as long of a period as possible, just for obvious reasons, because, hopefully that will give us time to develop a vaccine, to develop antivirals that can help cure this disease, and to help allocate resources. So that's basically what flattening the curve means, is really pushing that hump down so much that it just ends up being just a little blip over a long period of time.
Well, great. Well, thank you so much for that, Dr. Vohra. And before we move on, our medical system and our first responders are working overtime to keep us safe right now. And I wanted to make sure I express my gratitude to them. And it's not just the doctors and nurses dealing with this crisis, but the frontline workers in every city, from the janitors, the grocery store employees, who are doing vital work under very difficult circumstances. And they've been asked to do many things to keep you and me and them safe. And so I'd say if you have to go out for your supplies, always keep in mind, let's be kind and patient with them, and don't be afraid to show your gratitude. With that, why don't we get to our first question?
All right, Congressman. First up, we've got Deb, who wants to talk about some numbers of cases. Deb, you are live with Congressman Cox. Go right ahead.
Okay, from what I was understanding, there are only 2 cases so far in Fresno. Do we have any numbers for here in Kings County?
The most current numbers that I've gotten is that there's 0 cases reported. But again, these numbers change every day, and we're expecting that in the Central Valley, we're going to have increased numbers even by the end of this week, just because the number of labs that are being done, the number of patients that are coming in with symptoms that sure as heck look like COVID-19 are just going up and up. So we know that it's here. And the labs, because it takes several days to confirm with a lab test that somebody actually has this infection, are going to trail what is actually seen in the community and what's seen on the front lines in our emergency rooms and in our medical practices. So we know that these numbers are going to reflect what our doctors are telling us is already happening, is that they're seeing this illness out in the community right now.
Great. And Dr. Vohra, can you talk about the incubation period, I guess, of this virus, and that, from what I understand, you can be very asymptomatic, show no symptoms at all, but be very infectious.
Sure.
Prior to actually showing those symptoms.
Sure. Yeah, no, I'd be happy to. So this is probably the most scientifically studied infectious disease in the world. I mean, we've got the world's best experts looking at this. They've got the genome down. So there's a lot of scientific advances that are happening very quickly. And so that is actually a little reassuring. What's really concerning is that this virus is highly contagious, quite virulent, and even though, like I said, many people will have a mild course, it will also have a very protracted course in our elderly and our most medically vulnerable populations. And the reason that it's going to be hard to avoid that unless we all take a part is because of what you just described, which is the incubation period. So the incubation period for this virus, which means that, if I pass it on to someone else or somebody passes it on to me, it takes 0 to 14 days for the next person to show symptoms. And during that 0 to 14 days, they can interact with a lot of people unless they're really being mindful of all of the social distancing measures that we need to be doing. During that 14 days, they're going to develop usually some very mild symptoms like fever, maybe some shortness of breath, maybe some cough, but it's going to look like a cold or at worst like a flu. And most people, may blow that off. Unfortunately, the second week of the infection is when a small number of people go on to develop what we call viral pneumonia. This affects both lungs. It's deep down in your lungs. It's a deep hacking cough. You may be coughing up phlegm. You may be coughing up blood. A lot of these people will end up getting put on ventilators in the ICU, and that's a real concern, is that those people are really sick. So that incubation period of 14 days is before the person goes on to develop disease. Now, where does the testing come in? Well, if you have the virus and you're incubating it, but you're not symptomatic, it means that you're not really creating enough virus particles for the test to come back positive. So while you're asymptomatic, it's really not useful to be tested, because you could be fooled. If it comes back negative during that time, it might mean that you don't have the virus, or it might mean that you don't have enough virus particles to have the test become positive. Then when you become symptomatic, that's the right time to get tested. And at that time, if you're symptomatic and the test comes back positive, then we obviously want that person quarantined and protected, and we're going to follow that person very closely to make sure that they don't develop complications. The frustration with the test that hopefully will get worked out very soon is that it takes 3 to 5 days to get that test result back. And there's a lot that could happen clinically in those 3 to 5 days. The person could deteriorate clinically, and if they go back out of the hospital, then they could have a lot of interactions during that 3 to 5 days if they're not careful, and that's going to pass the germ on to a bunch of other people. And that's why we're telling everyone that even before you get your test back, the minute that you develop symptoms, stay at home. Stay in your home, use a mask if you have to go out, but stay at home and don't pass this germ on to anyone else.
Well, great. Thank you so much for that. And actually, at this point, I'd like to hear from you. So we're going to do a poll, and when you answer this poll, it'll give us a better idea how to focus the town hall, since I know your time is valuable out there. And you can respond to the poll by pressing 1 for yes and 2 for no. And here's the question: do you know what to do if someone in your family begins getting symptoms of coronavirus? Remember, press 1 for yes, 2 for no, or if you don't know, and we'll keep the poll open for a while. So please keep voting.
That's
and
great.
while we take that poll, we can take another question.
All right, Congressman, we're off to the Central Valley. Question about hospitals being prepared. We've got Travis on the line. Travis, go ahead with your question.
Yeah. I'm kind of concerned about what's going on, the talks with local officials and setting up triage units at the hospitals and stuff, getting ready for the increased patient influx that you were just mentioning. That's going to be coming up over the next couple weeks.
Yes.
Thank
you for asking.
Yeah.
I did. Great question, Travis. Thank you so much for that.
So every hospital is in disaster preparation mode, and that's what you're seeing happening. What that means is we've organized teams at in every medical practice, whether it's just a single practice, in a family practice office, all the way up to the biggest academic medical centers in our Central Valley. We are all in disaster mode, and we're all taking plans and making plans right now to say, okay, how are we going to handle the crisis that we know is coming up? So that is happening at every level. We're thinking hard and just trying to conjecture at this point, knowing what we know about the epidemiology of this virus, about how many patients is this surge going to look like, how many can we handle currently, and what's our capacity going to have to be to really handle the full caseload in a worst case scenario. The numbers are pretty grim. I wish I had better news, but if you take a 3% case fatality rate, that's going to translate to, in a city the size of Fresno, 15,000 deaths. And that doesn't equal all the folks that will survive, but they'll have a 2-3 month hospitalization in the ICU, which will be in the tens of thousands as well. I can tell you right now, we currently don't have the critical care bed capacity for that, and every single city in California is in the same lurch. And so that's why we really have to act now to prevent this germ from spreading in our society, so that we can really, like I said, flatten the curve, because we just don't have the capacity to handle that many patients, which is what the studies out of China and Europe are telling us might happen in a worst case scenario. So beyond that, all the hospitals are working extremely well. We're coordinating in an effort to really allocate our resources. As you've probably heard, the state as well as all of the counties in the Central Valley have declared emergencies. And what that actually does is it actually allows us to free up resources, to move personnel, to really allocate and be very flexible about the things that we need to do to respond to a crisis. And so by declaring these emergencies, that was actually just a very good move for us to do, even before we have a huge number of cases or any deaths in the Central Valley, because now we'll be able to plan and prepare even better before those things start to happen.
Yeah, that was a great question, and I can tell you, if you've been reading in the news, and we certainly talked to some of our friends who are in the medical field in Italy, particularly northern Italy, which is completely overwhelmed now. They've got radiologists, providing respiratory services. They just don't have the staff or beds available. They've been completely overwhelmed, and they've been trying to use their case as an example for us to be prepared. So thank you so much again for that, Travis. Once again, anybody online, if you would like to ask a question, please press *3. And also, anybody that's online, if you press *6, you can sign up for our e-newsletter to get more updates on our coronavirus and other important issues. With that, we'll take another question.
All right, this time, Congressman, we're out to Bakersfield, where Dolores wants to talk about her pregnant daughter-in-law and senior citizens and getting groceries. Dolores, go ahead with your questions.
Yes, my daughter-in-law is wondering if at 6 months she is still going to be able to go to work. Is it safe for her to go to work the next 2 months until she goes out on maternity leave?
That's a great question. So it sounds like there's two parts to that. One is, what is the risk to pregnancy? And the other is, what is the risk to just working? So I'll take the first one first, which is, there's no evidence that pregnant women have any worse or better chances than the average population. So right now, we're basically saying, the same measures that will protect an average person who's not pregnant are also going to protect your daughter-in-law and her growing baby. So really the same measures would count, which is good hygiene, making sure that you stay away from sick people. If she herself gets sick, she should mask and cover up her cough and stay out of crowded places. So really all of the same things that we're recommending for a non-pregnant person will apply for a pregnant person. Obviously, she should work with her obstetrician to make sure that everything's going well with her pregnancy, but there should be no reason to think that the pregnancy is itself going to be affected, inordinately by a viral infection like this. Secondly, should she go to work? Well, this is a bigger question, and it's a hard question because we all have to work. I mean, these are our livelihoods, but by going to work and by interacting with people, we actually put ourselves and our community at risk if we're not careful. And that's why we really need to think hard about the ways that we can work so that we're not around each other so much. And that's where the social distancing comes in. So if she can, I'm not sure exactly what kind of position she has, but if she can at all work from home or telecommute or even just change the physical space of where she works so that she's not around so many people, really the magic distance is 6 feet. And that's really the reason that they chose 6 feet is because that is about an arm span, so that's easy to measure out. And that's really about as far as our droplets travel. So remember, this virus does not have wings and it does not have legs. The only way that it gets from one person to another is inside the droplets that we kind of shed, I guess, or sneeze out whenever we're sick. So when you cough, when you sneeze, whenever you're just out and about, your personal airspace is about the 6 feet all around your head. And so if you just stay 6 feet from the next person, then you'll be safe to not catch whatever germs are coming out of them. And that really has some implications for how we work, because we need to really think about how we can minimize the amount of working with each other that we're doing right now and really just try to figure out ways to work from home, and to do telecommuting as much as we can. So I hope that addresses your question. I think that's an excellent question. We are learning more and more about subpopulations like children and older folks and people with diabetes, people with high blood pressure. But I haven't seen anything that says that pregnant women are at increased risk from this coronavirus, which is very reassuring.
Yeah, and Dr. Vohra, is that actually the White House, there was a press conference today when somebody brought up that very issue. And they do have experience in China where women have recovered, women that were pregnant have completely recovered and have delivered healthy babies there.
Yeah.
And so that is an important point. And once again, whether or not your daughter's job provides the flexibility to telecommute or work at home, is that we would say once again the social distancing is the key. We'll take another question.
All right, this one comes from Delano. We've got Vicente. Vicente, you are live with the Congressman. Go ahead with your question.
Yes, we have enough tests to detect the virus. Do you prepare for it enough money from the federal aid?
So, Vicente, you're looking to find out if there's enough money being set aside and space for this virus in Kings County. Is that correct?
In Kings County, because this is most of the people work in the fields.
Yep. Well, a great question, Vicente, and it gives me. Let me tell you what we've been doing on the federal side to confront this emergency. Last week, we actually passed an $8.3 billion bill to address some of the most urgent concerns we had. And now that money is going to be used for federal agencies, for states, and our local communities to make sure they have the necessary resources to respond to coronavirus. It's going to provide funding for prevention, preparedness, and response efforts. It's going to provide funding for the development of treatments and a vaccine, and also funding for low-interest SBA loans to support small businesses that have been affected. And then just this last Friday night, or actually early Saturday morning, 1 a.m, we passed a bill that it was the Families First Coronavirus Response Act. And we know we can't fight coronavirus effectively unless everyone in the country who needs to be tested knows they can get their test free of charge. And we can't slow the outbreak when workers are stuck with, the choice of staying at home to avoid spreading the illness, or foregoing a paycheck that their family can't afford to lose, just like Dolores just explained. So our bill, which we negotiated with the White House, the Senate still needs to pass it, but the White House and the House is in agreement on this. Does 6 very important things. And 1, free coronavirus testing for everyone who needs a test, including the uninsured. 2, paid emergency leave with both 14 days of paid sick leave and up to 3 months of paid family and medical leave. Very important. The first time paid family medical leave has been introduced in the U.S. 3rd, enhanced unemployment insurance, which is a first step that'll extend protections to even furloughed workers. 4, strengthen food security initiatives, including SNAP benefits, student meals, seniors nutrition, and food banks. 5, clear protections for our frontline workers, those healthcare workers and other workers who are in contact with those who have been exposed or responsible for, cleaning at-risk places. And then finally, increase federal funds for Medicaid as states face increased costs. And so, beyond that, we're monitoring the situation by hour, and I certainly urge the Senate to do its job and pass this bill. And so, Vicente, my office will certainly follow up with you specifically if you give them leave one of my staff members your information, and we can follow up with you specifically on any particular situation. And the question is really, and the broader question which we addressed, which we took the first step on addressing on Friday night to Saturday morning, is how is this going to impact families and individuals? It's going to have a huge economic impact from the farm workers to the, to the producers, to the pilots, to the people in restaurants, just everybody, the school workers. And so we want to make sure that we mitigate, the impacts that those are going to have on families. And so we've taken the first step on that, and you can be sure that we're going to make sure that everyone's taken care of as this unfolds. So thank you so much for that question. And we're certainly, let's take another question.
All right, Congressman, we're out to Kings County now. We've got Brian on the line. Wanted to understand the difference in flu viruses. Brian, go ahead with your question, sir.
Yes, I was wondering, why is this flu virus so different than the other flu viruses around? And if we're closing bars and winery places to keep contact around people down, why are we not closing churches as well? Because I go to church with a lot of other people that could have it. I don't go to the bars, but why do we not close churches as well if we're going to close bars and places of gathering, is my question.
Okay, so the first question is about how this virus is different. Well, this virus is the novel coronavirus, and it's not the only coronavirus. There's actually other coronaviruses out there that are, some of them are very dangerous, like you might have heard of something called SARS. There's another one called Middle Eastern Respiratory Syndrome. And these are all coronaviruses, and they're very deadly. And thankfully, they're not very common, but they were epidemics that we learned a lot from about 10 years ago or 5 years ago, just in the last couple of decades. Then you also have other coronaviruses. Again, not this one, but it's a whole family of coronaviruses, and some of them are actually quite benign. They cause things like the common colds. Some people just catch them. If you've ever had the sniffles and been out of work for a day or two, then you might have just had an ordinary kind of coronavirus. What we're dealing with COVID-19 is the type of coronavirus that's kind of on the dangerous side. I mean, it's definitely claimed a lot of lives worldwide. It's definitely claimed lives here in California. And so it's something that we're taking quite seriously because we are fearing that it's going to be one of the more dangerous types of coronaviruses. Having said that, all of the coronaviruses are completely different than the species of virus that causes the flu, which are the influenza viruses. So there's influenza A, influenza B. And the thing with those is, we have vaccines against those. And so a large number of people in the community have been vaccinated. And even if they haven't been vaccinated, or whether they have or not, they've actually had a type of influenza virus sometime before in their life. And so their immune system remembers that. So they have some residual immunity so that, whenever there's a new kind of flu strain out there, it doesn't claim a lot of lives. I mean, it still claims lives, but it doesn't claim everyone because people have immunity to this strain based on the fact that they had other flu strains. With this virus, the novel coronavirus, this has just jumped from animals to humans. So human beings as a species just do not have the immunity that we have to things like influenza, and that's why this virus is quite concerning, is because we are treating it as a totally new pathogen where no one is expected to have immunity, there's not a vaccine available, and so people are just going to have to react to this with whatever their own immune system can muster, and unfortunately they may not have enough time before it starts to cause that viral pneumonia. So hopefully that explains the science part of why this virus is so dangerous and so different from influenza, is that it's just like it's a different species of virus that our immune system is just not ready for. Your second question was
well, it certainly was about about the gatherings, and I know exactly what you mean. In fact, just yesterday was the first time I can ever imagine or remember in my life that Mass had been canceled, right? And I know that a number of churches have moved to online formats to allow parishioners to participate from their own homes. But the president's direction today is that we shouldn't be joining in gatherings of over 10 people. And I certainly would agree about that. And although that the government can't legally shut down a church, I think we'd all agree that they should be adhering to the recommendations of the governor or the president, just the same as any other commercial establishment. And the same thing goes with just some of these places of large gatherings.
Yeah,
just like the NBA has and NCAA, and I mean those are. It's a shame that we're not having them, but it's a shame to have the consequences that you've described earlier.
Right. We're just trying to prevent deaths. I mean, that's the end. That's the bottom line.
Great.
The public health departments are actually working with a lot of the stakeholders in the community, including faith-based organizations, to see how we can guide some of the mass gatherings and some of the events. So we're definitely working. We're definitely working together and make sure that people have all the information they need to plan. But yeah, with the state mandating that gatherings greater than 50, that's the limit. So that you're going to see a lot of changes in faith-based events as well as social events, weddings, concerts, etc. Just based on that guidance.
All right, and we'll take another question.
All right, this one comes from Melissa in Parlier. Melissa, you want to talk about temporary layoffs? Go ahead, you're live with the Congressman.
Hi, Congressman. Thank you for having our town hall.
Absolutely.
My question is, so my dad is 84 years old and he still works, and he works for a private Catholic school, and he got laid off for 2 weeks. So not having the virus, how can Congress protect him or provide for actually any person that gets laid off during this time? Will there be any coverage in unemployment insurance?
Yeah, absolutely. That's exactly what we passed on early Saturday morning. Is that one? There's going to be enhanced unemployment insurance. That's a very first step to provide extended protections for just those furloughed workers. Then there's paid emergency leave with 14 days of guaranteed paid time off, and up to 3 months of paid family leave and medical leave if you have that. And so those are two things, two very, very positive steps. And so we want to make sure that that people need these paychecks. And so and my staff is certainly working. If you have particular issues, that you want to call back to the office with, if they need to apply for any of these benefits, we're very, very happy to help. But here's the thing is that certainly God bless your father for keep on working at 84. I mean that's very, very commendable, and that's something I hope to get to. But at 84, the fact is that you were at a very, very high risk to be out there. So one of the safest places he can be is at home as well. And so we're already in talks also with a third package. Once again, with the point being to be able to mitigate any harmful economic consequences of this situation, and so we can pass this third package to ensure that folks and certainly small businesses and our overall economy can weather this. So thank you for that question, and certainly I hope your father stays safe, and hopefully that we'll be back to work before too long. Other question?
The next question we've got on the line, we've got Abby talking about diabetes. So Abby, what is your question for the Congressman?
I have two questions, and I was just wondering, because I'm a type 1 diabetic, and I'm 19 years old, what could happen to me if I came into contact with COVID-19? And my second question was going to be, do we really need to be panic buying? Because, I live in a small town, and there's no toilet paper in any of the stores, no bread, no milk, no eggs, no baby formula. Why are we encouraging people to panic buy when it's just 2 weeks of being quarantine, I guess?
Yeah, great question. So your first question is about your health condition. Type 1 diabetes is certainly a serious condition, and I hope that you're doing okay with that. I would definitely just make that phone call to your doctor and just see, because not having your individual history and things like that, it's hard to make a blanket statement. But in general, as long as you're otherwise healthy, I think that your risk of having a complication is on the low side. Just because this is really a lung illness, and most of the people that are having problems are elderly and have lung problems, etc. But again, I would say contact your doctor. It's a great time to just have that call with them. You don't have to go in physically, but just call your doctor or a provider and just ask to see if there's any steps that you can take about minimizing your risk. Things like your prescriptions. Maybe they could call in longer prescriptions for you so you don't have to go as often out to the store. Things like that are all good ideas to be doing right now. So like I said, we all have a role to play. We all need to minimize our interactions in crowds and in public places and in the number of surfaces and things that we touch, because these droplets are just going to start getting everywhere once this virus really ramps up. And you're going to have to be very mindful of just cleaning your hands and not breathing in viral particles.
Yeah, and it's a great point, and certainly I very much appreciate the situation you're in, and diabetes is something that we are absolutely focused on here. And in fact, earlier this year we had a report commissioned, and we found out that the families in the 21st Congressional District pay an average of $1,200, $1,240 I think it was, every year for just analog insulin, which has been like 1,000% increase over the last 20 years. And actually 1 out of 4 people in the district have to ration their insulin. And I thought that was just outrageous. We passed a bill earlier this year, H.R. 3, to be able to bring down the cost of these prescription drugs and certainly things like insulin. And we know we can get there. And so that is one of the things that we're absolutely focused on, bringing down the cost of prescription drugs, bring down the cost of medicine. And certainly hope that is going to help in your case. And with regard to, the panic buying out there with people hoarding, sanitizer and toilet paper. And I was in a market the other day. I could not believe how long the line was. And there's a little bit too much hysteria. We don't need to panic. We need to simply prepare, right? We don't need to panic. We need to prepare, and we need to prioritize the types of things that we need. And, and what we also need to do is keep in mind that when you're buying all these types of things, you might be taking it away from, a senior, right, that won't be able to get it, or somebody else. And so it's more about, knowing that you're a part of the community, and not hogging it all for yourself. And I tell you, I've seen some great circumstances or instances of people sharing and looking out for their neighbors. And that's really what, that's what we're all about here in the Valley. And so once again, let's not panic, let's prepare. Let's get to another question too.
All right, this next question, Congressman, comes out of Bakersfield. We've got Renee on the line to talk about quarantine.
Renee?
Hello, Renee. What is your question?
Hi, I was just going to ask, do we know when the quarantine is going to start and how long it's going to be? And are we still going to be able to go to work when there is the quarantine?
So, yeah, the word quarantine obviously it can mean a lot of different things, and it often raises concerns. So when we say quarantine, that's usually something that's decided by the health department in your county. So if you're from Bakersfield, then the Kern County Department of Public Health will decide if you need to be on quarantine. So far in the Central Valley, we've really just decided to isolate or quarantine people who are at high risk because of travel history or because they have a close contact with someone who has this virus. I know that there's things that we recommend whenever you're asked to self-isolate, and it's not just staying inside your home. It's really just protecting yourself and your family from catching this germ or passing it on. So if you're being asked to quarantine, it means that you're considered higher risk, and they really want you to pay attention to really just basic common things like hygiene. Clean your hands often. Use hand sanitizer if you have it, But again, don't panic if you don't. Good old soap and water is just as good. Soap and water is more gentle on your skin than hand sanitizer, and it kills this virus really easy. So it's not like you have to work really hard. You just have to be very mindful that you're cleaning your hands multiple times a day. Then avoid touching your face, and especially your eyes and your nose, because that's where the virus likes to kind of live, is inside all of the wet parts of our face. Avoid close contact. Like I said, keep 6 feet between you and everyone, including those in your household. And really, if you're sick or someone else is sick, you should absolutely not even be in the same room with them. I mean, whenever someone's sick, we know that they're coughing, they're sneezing, they're really blowing out virus particles all around them, and you can just kind of imagine this cloud of virus that's surrounding them at all times. If they are having those symptoms, then they're the ones who should be wearing a mask. Not if you don't have those symptoms, you don't need to wear a mask. But the mask is really just to protect everyone around them from catching all those viral particles that are kind of exploding out of their face. Sorry about that graphic metaphor.
Yeah.
Use tissues and then throw them away right away. Don't leave them out on tabletops. And really just use a very dilute bleach solution to just bleach down all of your common surfaces, your doorknobs, your keyboards, your TV controls, etc. And really, these are just simple steps that we can be taking, but they're going to be absolutely important to minimize the spread of this virus back and forth. So when we say quarantine, I mean, that can mean something a little bit graphic to some people, but we're really just saying use these common sense procedures to make sure that you're not passing the germ on. And we know that the more people stay at home, inside their own room if they're sick, but definitely stay at home if they're sick, those are the people that we really want them isolated and in their house, because we don't want this germ getting out. So that's what we mean by quarantine, is, the people that have the COVID-19, they're going to get quarantined by the health department for 2 weeks to make absolutely sure that they don't pass it on to anyone else.
Yeah, for now, I certainly don't think this. We're not at the point yet where anyone's going to be told that they don't have the symptoms or they don't have the disease.
Right.
You have to stay home. But right now, it's we're voluntarily doing this because we want to protect each other.
Yeah.
Right. We want to protect the elders and make sure that I'm not going to infect somebody when I may have a disease. As we talked before, and I can tell you that. Once again, if anyone online, press *6, and you can sign up for our Central Valley Coronavirus Information website. That'll be updated daily, hourly, with the latest information on the pandemic and how it affects our communities. So *6 to sign up for the Central Valley Coronavirus Information Center. So with that, we'll take another question.
All right, next on the line, we've got Angelica from Fowler. Talk about testing centers. Angelica, go ahead with your question, please.
Hi. Thank you so much for taking my call and for notifying me that you're going to have a town hall meeting. Also, my question is, during President Trump's White House briefing regarding these drive-through centers, will any be available here in the Central Valley, say at Walgreens, Walmart, CVS? Will any of these drive-through centers be located here? I know, like in Seattle, because of that whole situation over there, they're putting them there. But they were going to have these they call them fast-through drive-throughs, where they would be tested for the most vulnerable when they come through that drive-through. So I was wondering about that. And then my second question would be the 3% that would be affected. Is that worldwide? Is it United States-wide? Is it Central Valley? Is it California? Where do you get that statistic for 3% that might be affected?
Those are great questions. I'll take your last question first because it's kind of the easiest to answer, and that's to say that, we've had hundreds of thousands of cases at this point. Most of them have been in China and Europe, and so most of our statistics come from there. So when we say 3%, that's really based on, very large populations that have been affected, and 3% of them ended up having a demise. So that answers that question. Your first question is also a very good one, which is how are we going to operationalize all of the testing? And I can tell you that that's something that we are working on full blast and really trying to get that dialed in, because we know a lot of people are very anxious to get tested to make sure that they don't have this virus. If they do feel sick, how do they know that it's not this coronavirus? It seems like drive-through testing is being done. We know other countries have succeeded with doing it, and that basically helps to minimize the interaction, because you don't even have to get out of your car. You definitely don't have to walk into a hospital. You basically just roll down your window, somebody swabs your throat, and then you drive away and go right back to your house. So for a lot of reasons, that's a very efficient way to get this testing done. Now, this is something that may be happening, just depending on where you live. Sorry, I didn't catch where you're calling from, but you really just have to keep up with what's going on in your locale, because this is changing so quickly. So I haven't heard of anything happening in terms of drive-throughs in the Fowler area, but we know that in Fresno, which is where my public health department is, we're already working with certain clinical sites to make sure that we can get mass testing done, either people walk up or drive through, and we can just get them swabbed and tested and then move on. So that's already being organized. If you want to get more information about where to go, I would say check your county Department of Public Health website. For Fresno, that's the Fresno County Department of Public Health, and the phone number that they have is 600-3332. Keep in mind, it's a hotline. It's really busy right now. And like I said earlier today, if you feel like you have fever and sickness, the best thing you can do is just stay home and try to recover if you feel like you can just recover on your own. Because regardless of whether you have this COVID virus or not, it's going to take 3 to 5 days for that result to come back, and we're going to tell you the same thing. When we test you, we're going to tell you the same thing. We're going to tell you, stay at home, keep everything clean, don't cough on your loved ones, and just try to get better with lots of fluids and some chicken soup and just some TLC. And that's really all there is to it. Most people, when they have mild illness, they just need to stay home, shelter in place, and just get better on their own. And then when your labs come back and it turns out you do have COVID positive, guess what we tell you to do? Stay at home, don't cough on your loved ones, drink lots of fluids. It's the same exact advice. And so that's why the lab testing is not as important. Because if you feel like you have something that looks like the COVID, which is basically if you feel like you have the common cold, then we're basically going to give you the same advice, is just try to get through it as best as you can. Now, obviously, if you have multiple medical problems and you feel like you just can't catch your breath, then you're going to need some medical attention. But for most people, they're going to get better in about 2 days with this. And that's what needs to be. That's what we need people to understand, is that you don't need to rush in at the first sign of a fever. You should really just try to get better on your own. And we really need to be reserving all of our medical resources, whether it's the labs or the hospital spaces or the ICU beds, et cetera, for the people that are really going to get sick from this and the people that are really going to get complications from it. So.
Well, and Doc, can you tell me? I mean, are the symptoms of this virus of coronavirus, COVID-19, are they any different than a flu or cold, or is there something that will tip me off that this isn't COVID? Or
I wish there was.
Right.
I honestly wish there was. I wish that your nose turned blue or something like that. But unfortunately, it looks just like you have the common cold. Mm-hmm. It really does. Now, did you know that every year in this country, we lose 20 to 40,000 Americans to influenza?
Right.
That doesn't mean that if you get influenza, you're automatically going to die. It just means that the sickest Americans that have a lot of predisposing medical conditions are extremely vulnerable. And so that same principle applies to this virus, is that, most people who are going to catch it are going to recover, and we know that. Unfortunately, the ones who are already kind of sick to begin with are older folks, are people with lung disease, are people with cancer whose immune systems are weakened. We know that they're going to have more complications, just like with influenza. So clinically, this looks just like influenza. Clinically, people just, most of the time, have a few sniffles. They're going to get better with just, a couple of days off of work or school. They may need to stay in bed for a long time for just a couple of days, but they're going to bounce right back. And hopefully, if you end up catching this virus, then you'll be in that category. If you're not, and if you get sicker and sicker, that's when it's time to think about calling your doctor first, Again, I wouldn't rush into the emergency department. I would call your doctor, or if you have insurance, and call that nursing hotline that a lot of insurances offer. You can certainly try to call the public health department, and we can try to get you arranged for care and testing at that point. But again, it shouldn't be on that first day. Really, if there's any takeaway that I want your listeners to take away is that, wait 2 or 3 days if you can and see if you'll get better, because chances are you will. And if you're not better by day 4 or 5, then it's time to say, you know what, maybe I should go ahead and get that lab test done and get checked out, because maybe there's something down deep in my lungs. But just give yourself 3 or 4 days of just trying to tough this out at home. Because right now we have a lot of people that just want to rush in on that first day, and that's really mucking up a lot of the resource allocation that we're trying to figure out as we organize for this crisis.
Yeah. Well, I can tell you, it was earlier this year, maybe a month or so ago, I had the flu or something like that.
Yeah,
for the first time. It was the first time I was not able to get out of bed for basically a day and a half, cold sweats and everything, and it was the worst flu I've ever experienced that I can recall.
Yeah, it can be miserable, but there's over-the-counter remedies. You can certainly take fever medicines. Just staying hydrated is such a big part of this. And eventually your own immune system, fights back against these viruses. You just have to give it a couple of days. And most people, like I said, do just fine and recover. And fortunately, most people will do just fine and recover with this as well.
All right. We took a poll earlier, and so would love to hear the results of our poll here.
Okay, Congressman. So the results of the poll that was asked at the beginning of the call, it's actually pretty promising. The question was, do you know what to do if someone in your family begins getting symptoms of coronavirus? 54% of the respondents said yes, they do know. 46% said no. So again, pretty promising results in our poll this evening, sir.
Well, very nice. And for that 46%, Dr. Vohra, if you could remind them, once again, what should we do if someone in the family begins getting symptoms of coronavirus?
Thank you. Yeah, this is very instructive for me as a physician. Really, just know this is not a reason to panic. This is something that all of us are actually very prepared for. It actually feels and looks like the common cold. And you're going to get through it with some basic fever medications, pain medications, and really just taking good care of yourself with adequate hydration, eating as well as you can. It's funny about the toilet paper because diarrhea doesn't really seem to be a part of the problem. So it's a little puzzling why people are hoarding that. I mean, I guess if that's what makes you comfortable. That's
really?
fine.
I was reading. It was with a patient who was giving us day-to-day updates, and so he had the fever, this and that. But then about day 3 or 4, he had a couple days of diarrhea.
Yeah. It doesn't seem to be causing like such bad diarrhea that your electrolytes get problematic or that your kidneys shut down. So it's not like it's not a life-threatening diarrhea. You may get some loose stools, but mostly it's just respiratory.
Right.
And you may get a sore throat, you may get a short of breath or cough, and you just got to take it easy. You may not be able to get around the house as well, but you'll get better. So hopefully you'll have a good direction with just those basic principles about what to do, which is, again, don't cough on your loved ones, don't go out in public, avoid the coffee shops, the restaurants, etc., and just stay at home and try to recover at home as best as you can. And if you feel like on day 3 or 4 that you're just not getting better, that's when it's time to make that phone call to your doctor and see if you can get arranged to get seen and maybe get some prescriptions at that point to help with the cough. Again, there's no vaccine, there's no antibiotic. This is really just your own immune system is going to fight this. So the stronger your immune system, just due to good nutrition, the better chance you have of a good recovery.
Okay, and then I guess once you do have it, once again, plenty of fluids, plenty of rest, some of the over-the-counter symptomatic type medicines that are available there.
Yeah. Cough and cold medications. Those are really going to be a good bet for you at this time. And then obviously, good hand washing. That's really key also because again, we're just trying to slow down the spread of this germ from person to person, and really it's all about good hand washing and making sure that you're cleaning all of your commonly used surfaces so that you don't pass it on to your friends and neighbors.
Great. Okay. Well, we are getting close to the end of our session, but we'd like to get in at least a couple more questions. And so, Dirk, if you have another question for us.
Absolutely, Congressman. This one comes from Carla. We've got her on the line to talk about the Kids and Free and Reduced Lunch Program. So, Carla, go ahead with your question for the Congressman.
Hello, Congressman Cox. This is Carla Roscoe out at Acres School at NAS Lemoore. So I'm pretty worried about our kids who get 10-plus meals a week at school. I know the governor says they'll get their meals, but logistically, we close pretty quickly. And so how are you going to help, the kids in the rural areas, especially the kids on base? The base shuts down. So what kind of services can you offer them?
Well, I know, Central Unit District is working for, the to-go meals for kids. And certainly with the bill that we passed the other night, we wanted to strengthen food security initiatives, for, as I was saying before, for certainly SNAP, student meals, seniors nutrition, and the food banks. I think there's almost $1 billion for those types of things. They're waiving the requirements about how they have to be delivered. And I know that some of the districts, there's no mean testings. You drive up, you get the food. And so what I would say for right now, and I don't have the exact particulars, as I said, I know that the Central Union was working on the to-go meals, but to keep in touch with the district, and I know that the other schools, if that they're providing, basically student lunches or student breakfasts, to call the school. And so, and if they're having a hard time figuring out those logistics, certainly call back to my office, and we will reach out to them as well to be able to coordinate with the USDA on how we can best expedite getting those kids and those families those meals. And I guess the team is telling me that the next question will be the last question we can take tonight. Before we do that, I want to thank Dr. Vohra for joining me again, and I know he's got lots of other things he needs to do, but I know he agrees that keeping us all informed is one of the most important functions of government. Sir, we're grateful for your time.
Thank you. I really appreciate the opportunity to speak with your listeners, to field these questions, which really help inform me about the kinds of messaging that we need to craft. And I hope to continue the conversation.
Great. Let's take one more question.
All right, it's out to Bakersfield. We've got Amber on the line. And Amber wants to talk more about school closing and keeping the children on schedule / on track. Amber, go ahead with your question.
Well, actually, now I have some other questions. President Trump said this morning that we need to go back to the source of the virus. And he said he was looking into the similarities to like the 1917 virus, the Spanish flu. And I have a question. In 1917, we went on to radar technology, and Wuhan, China went live with 5G on Halloween, and T-Mobile just went live with 5G, 200 million Americans this week. And we're hearing that the schools are being upgraded with this 5G technology, and I was wondering about electronic radiation poisoning, if that was of concern, and if that could make you sick. And the Princess cruise ship went live with 5G last month. And I was wondering, does this have anything? And on Saturday, I was driving down Union, and I seen a inferno and a furnace with FEMA coffins going to Fort Tejon, the FEMA camp at Fort Tejon. And that scared me. And I'd like to have answers on these.
Yeah, I haven't read anything about a connection.
No, not much either. And so, it's that's certainly that's I tell you what, those nuanced type questions. Certainly, we have staff, and we've got our current county office right there in the government center. And if you stay online and leave your information, we can have staff follow you up on directly with that. And so with that, I'm afraid we're at the end of the town hall, and I know that some of you were not able to ask your questions tonight, and others have questions on more other issues outside of the COVID-19 pandemic. And I'm happy to let everyone know that anyone who asks a question will receive a personal response from me. Once again, I want to thank Dr. Rais Vohra for joining us. I know he's working every day to stay on top of this issue, and we're certainly grateful for his service. And I also want to ask you again to be patient and friendly with your neighbors, and especially these frontline workers like the grocery store employees, the custodians, public transit workers, who are putting themselves on the line to make sure we're safe. We are all in this together, and I've once again been really touched by some of the incredible acts of selflessness I've seen in the Central Valley neighbors do for each other. Please check in on your neighbors and the most vulnerable in your life. If you have a neighbor who may be susceptible to the virus, you can be incredibly helpful by both checking in on them, offering to help them with errands and other things. And I also want to urge you to regularly check my website, the cox.house.gov, where, once again, our Central Valley Coronavirus Information Center is updated with the latest information on this pandemic and how it impacts our communities. And so thank you, everyone, for joining us tonight. I know these might be kind of scary times, but when we stick to the facts, we know what causes these diseases, and we know that we'll be able to get through it all together. So thank you. Good night. Stay safe, and please wash your hands. Take care now. Bye.
Congressman Cox, thank you very much for putting this call together. For everyone on the call tonight, we appreciate the opportunity to speak directly with you and answer your questions. If we were not able to get to your question this evening, you can leave a voicemail after the event. You can send an email through the Congressman's website at cox.house.gov or by calling the Congressman's Selma office at 559-460-6070. We will host more of these events in the future to keep you informed on what's being worked on your behalf in Washington, D.C., resources that are available to you, and other important updates. Thank you again for joining us on this call, and have a pleasant evening.